Broward Community and Family Health Centers, Inc. is a nonprofit healthcare organization whose mission is to provide accessible, comprehensive, high-quality primary and preventative care services to all persons with dignity and respect. As a healthcare safety net provider, the organization currently operates 3 centers in Broward County, and for over 13 years has continued to improve the health and well-being of the communities by reducing and eliminating health disparities in all age groups. Its structure and management is the foundation upon which all of its services are built. A deeply committed management team works together with the board of directors, staff members, volunteers, community partners, and patients to carry out the center's mission. The journey over the last 13 years has been filled with challenges to overcome, changes to embrace, and milestones achieved. Broward Community and Family Health Center, which was initially named Sawgrass Health Services, was formed at the request of the Bureau of Primary Health Care in February 1998 to provide continuity of care to the people who were left without a medical home following the defunding of another federally qualified health center.
They closed down the health center, Sunshine Health Center, and then they got the grant to open a new center. The biggest challenge we had was the separation part, making people believe that we weren't part of the other organization, that we were a new organization and we were out to help the people. We had a very new board, a very new organization. We didn't have directions. The medical director was doing everything. We didn't have the correct CEO. We didn't have the correct organizational skills.
I love serving the community. I love serving people in need. So I decided to accept the position. I came right out of my residency and accepted the position as the medical director. And we determined that we needed to start to practice and establish care for the community. We wanted a sense of the people to feel that the health center was a part of the community. And so the board of directors changed the name to Broward Community and Family Health Center. And that was the philosophy, culturally sensitive healthcare to people that truly need help.
And so with the formation of Broward Community and Family, the feds were very instrumental in bringing both hospital districts together to say, look, we want to commit to this community and we want you all to be a part of that commitment to this community in assuring that Broward Community and Family, it wasn't called Broward Community and Family at that point, they hadn't even named it yet, but assuring that their federal investment stayed in place in this county.
When Sunshine Health Center left the area, we really welcomed Broward Community Health Center into the area and have a community partner. We don't have to do this all ourselves. We don't have to control everything. It's really important to have community partners.
We felt that it was our job as a partner to step up, and we supplied both some interim financing and some office locations and some legislative support for the reenactment of the health center.
We were having difficulties securing a CEO, and so we took our case to Betsy.
Betsy Cook was the first president and CEO of Health Choice Network, a not-for-profit coalition started by a group of community health centers who shared a common mission of expanding access to health care and an interest in collaboration to forge closer operational relationships. Under Betsy's leadership, Health Choice Network became recognized as a national model by the Health Resources and Services Administration's Bureau of Primary Health Care. An inspirational leader, an honored professional, a tireless advocate, a trusted friend, Betsy will always be remembered fondly by Broward Community and Family Health Centers and everyone whose lives were touched by her warmth and her wisdom.
She, as well as Jesse Trice, led to the development of the Health Choice Network. And at the time, Broward Community Health Center was the only health center in Broward County, so it was imperative that Broward Community Health Center be a part of Health Choice Network.
I became involved with Broward Community Family Health Centers actually before it was even named that. It was Sawgrass Community Health Centers. It was about 2001. They were looking for some assistance with their computers, their billing and registration systems, and we became involved at that time. It was a different time for the center at that point, going through a lot of transition. And shortly after we became involved, they were looking for a new CEO for the Community Health Center. And along came Rosalind Frazier, and the rest, as they say, is history, and it's been a wonderful relationship ever since.